call it a myth because I don't think it's true that we're weak and we need to be scared during pregnancy and we're fragile. Like, it's not the case.
Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast.
All right, welcome back to the Advanced Women's Health Podcast. My name is Dr. Heather Elford. I am one of our naturopathic doctors at our Brooklyn location. I am very excited about doing a podcast today with Dr. Erin Kooy, who, if you didn't know already, actually, we happen to be sisters. So that's really fun. So, Erin, feel free to introduce yourself.
Yes, thanks, Heather. I am Dr. Erin Kooy, chiropractor at our Port Credit location at AWH. Super excited to be on the podcast today with my sister, but also I just think it's so valuable to be able to have different types of practitioners kind of share their insights and how we treat patients and how our approaches can really complement each other well. So excited to be here and to dive in.
Yeah. So I'm really excited about our topic today. If you haven't heard some of the other podcasts that I've been on, I love talking a lot about pregnancy and postpartum. And I know, Dr. Erin, you've done some additional training in supporting that population as well. But what we're going to really dive in today is talking about navigating those body changes that you may go through pregnancy and postpartum. There's a lot of things that go on with our bodies as we're creating human beings and sustaining them. And as Dr. Erin and I were talking through our podcast preparations and talking through all the things that we wanted to chat about today, we were laughing about this girl with the list. So, Erin, can you tell us about what the girl with the list is?
Yeah, so if you've never heard of the girl with the list, she's on TikTok and Instagram, and every once in a while she'll come out with a new video, and she has this seemingly never-ending list of all the things that could possibly happen to you during pregnancy. I think she's in the 400s for sure. Like, I don't know at what point she's at here, but we joked as we were talking about, oh, what are some things we should share in this podcast, that we were basically becoming the girl with the list. So it's not going to be that long, but our goal is really just to talk about these changes as them being normal changes, intentional changes that happen during pregnancy. So we just want to have a conversation about them and normalize that.
Yeah, I think it's really helpful as you're going through pregnancy and postpartum. There's so many times that people are like, oh my goodness, have you ever experienced this? Like, this is happening to my body, or these changes are occurring. And it's really helpful to know that you're not alone in that process. And so, again, as Dr. Erin said, we want to normalize that, but also really celebrate what women's bodies are capable of doing as we are growing human beings and sustaining human beings. And so we want to celebrate that, but we also kind of want to shed some light on if you are experiencing some of these changes and that you're not feeling like yourself in that there are things that we can do to actually support that and ways we can dive deeper with you to actually help you feel like you have a really positive experience through pregnancy and postpartum. So we're going to start and dive on in. Erin, I want you to tell us kind of some of the physiological changes, some of the things that you see coming up a lot, even with your patients through pregnancy, especially.
Yeah, for sure. So as a chiropractor, just kind of context before we dive into all of that, my focus is really on the musculoskeletal system. So if you're not familiar what that is, it's your muscles, your joints, bones, nervous system of the body. And so I really manage any kind of conditions that come from any of those areas and really work to help that system function as best as it can. And so I'm sure as you're listening, you can already start to think about some ways like, oh yeah, my joints or muscles, or like I have these different conditions that you're thinking of. So a lot of common ones that I see during pregnancy, things like low back and pelvic pain, hip pain, but honestly, like head to toe. And I think we'll dive into a few of those different areas. But to kind of set the context for how some of these sort of conditions can develop, we kind of want to look at a hormone called relaxin. Now, I know Dr. Heather's probably going to talk lots more about hormones, but I'll just introduce this first one. And relaxin really has what it does in its name. So it essentially relaxes everything. So if you think about what your body needs to do during pregnancy, is it needs to support a growing baby. And so relaxin really helps to relax the ligaments that support our joints, help the pelvis especially really open up. And again, this is so intentional and so important and purposeful to support the growing baby. But sometimes with that increased sort of joint mobility, sometimes there can be discomforts that come with that. And so that's sort of part of what I work on, is supporting the joints, both through hands-on care, exercise as well. But that's sort of the kind of key physiological part that drives some of these changes that I see in that body system.
Yeah, I think that's helpful to say. And so I know that a lot of times, myself included, especially by the end of pregnancy, you are feeling quite sore, and there's a lot of things that are kind of changing and going on there. I think one of the biggest things that I hear from a lot of patients as well is that sciatica pain,
Mhm.
particularly. So can you speak a little bit to some of the things that you do in supporting patients, particularly to the end of pregnancy? Because I feel like that's when a lot of times people are feeling a lot more of those like aches and pains and
Yeah.
soreness.
Yeah, for sure. So that's a big thing that I see. And I guess like some context before I dive into that too is that a lot of these physiological changes happening in the body are also part of sort of posture changes that happen as well. So especially later in pregnancy, you can think about how as the belly's growing, it sort of changes the way that gravity affects your body. So if you kind of are to picture a line sort of from the top of your head down through your spine and to your feet, as you have a bigger baby, as you're growing your belly, your sort of center of mass shifts forward a little bit. You can kind of picture that happening. And as that happens, your pelvis tilts forward. And then our body is so amazing at adapting to these new positions that it sort of sends this change in postural adaptations all the way up the spine. So the low back arches back a little bit more to keep you upright, and then you can kind of keep working up. It's sort of this chain reaction of things that happen. And so with sciatica, especially with that sort of change in pelvis, change in the orientation of the low back, it can sometimes put a little bit of extra pressure on that sciatic nerve. It's a big nerve on the back of your leg, supplies essentially all the muscles in your leg and lots of sensation in the skin as well. So if it's compressed or irritated a little bit with that change in posture, then sometimes you can get those sort of numbness, tingling, or pain in the back of the legs as well. The good news is that chiropractic care, hands-on care, and exercise is really effective in managing that.
Yeah, that's good. Good to hear that, obviously, for those that are really struggling with that.
Yeah.
I think as you were mentioning some of the different postural changes too, one of the biggest things that I also see is that obviously breast tissue changes are happening
Mhm.
through pregnancy and can even happen like right away. A lot of people kind of note a lot of breast tenderness at the beginning and a lot of enlargement of breast tissue as we have
Mhm.
more of those lactocytes developing. We have those milk ducts preparing for potential breastfeeding that could happen afterwards. Can you talk about like some of the changes that you even see with patients that way? Because obviously we have belly that's growing, but heavier breast tissue can also contribute quite a lot to some of those changes too.
Yeah, absolutely. So, as breast tissue is increasing, and kind of what we were talking, we're starting in the pelvis and working up, those postural changes happen all the way up the spine. So, often what I'll see is a lot of kind of rounded forward posture, mid back sort of might increase sort of that bent forward position as well. And that can contribute to mid back tension and stiffness all the way up to the neck. Things like the ribs might feel a little bit irritated as well. And again, I feel like we're going to keep coming back to the idea that this is so intentional and your body is so amazing at adapting to these new positions and new postures. And really, like the change in your posture that you're noticing is just a testament to how your body's able to adapt. So I think it's like a great thing to reframe that instead of, oh, my back is hurting. Yeah, it's adapting and changing, and it's so capable of that. And so again, similar hands-on care, mobility exercises can really help to improve discomforts that you might feel in those areas as well.
I feel like every mom, especially like listening right now, has probably just like straightened up a
Yeah.
little bit, put their shoulders back. I know that you were saying that, and I was like, oh yeah, I'm sitting like that too. So I think that's really good. And it's helpful, obviously, to have a practitioner that's going to be able to walk you through how to do those things and like support
Yeah.
them that way. I think one of the biggest things that I hear a lot from moms, both in my practice and personally, is the challenge that comes with a lot of weight gain that happens within
Mhm.
pregnancy, whether that's the belly, whether that is breast tissue. So I often like to talk about this with patients and really break down where some of that weight gain is actually coming from, because mentally
Mhm.
that can feel really challenging. You are in the span of 9 months likely gaining more weight than you potentially ever have in that kind of time frame before.
Mhm.
And so obviously, there's different kind of guidelines and recommendations for how much weight gain a person should experience during pregnancy. But on average, if we're to kind of break it down where some of that weight is coming from, sometimes that's helpful to even conceptualize. So,
Mhm.
kind of towards the end of pregnancy, a baby is going to contribute around 7 pounds or so of that increased weight. We see that the placenta itself contributes around 1.5 pounds. We have close to 2 pounds of just amniotic fluid. The uterus even has this muscular layer that is developing to
Mhm.
help push out baby if you're having a vaginal delivery, and that increases by around 2 pounds. We have an additional blood volume amount of around close to 3 pounds. Extra body fluid that is close to 3 pounds as well. As we mentioned before, the breast tissue, often we see that is increasing around 1 pound. And then we have an additional close to 9 pounds of fat stores that are there and helpful for actually allowing for breastfeeding to happen. And so sometimes it's really helpful to actually break some of those numbers down and being like, it's not that I'm just gaining weight, it's that there's actually a lot of other fluids and tissues and things that are developing so that we can better sustain baby and better sustain ourselves in that process. And so there are some difference in guidelines about whether to frequently test and assess weight during every prenatal visit. And so you'll
Mhm.
kind of see some differences between different care providers as well. But sometimes it's helpful to actually break down those numbers and say, like, okay, as we're increasing weight, there's actually purpose and there's different things that are actually developing in that time.
Mhm. Yeah, I think that's actually really cool to see the breakdown in all those different ways that there is the weight gain, but it's so cool to see how the body is like sort of increasing everything to support the baby and just seeing how all the different systems are adapting. It's so cool. And it brings this idea to my mind that you can almost think of pregnancy as like a marathon. Like if you think about somebody preparing for a marathon as they're training, their body's doing a lot of these similar things. And it brings me this idea that kind of with those aches and pains that we were talking about, it's not surprising in the sense that your body's changing literally every single day in so many ways. And if you think about if you were to do a workout or you did a little bit more movement one day than your body was used to, you might feel a little bit sore and stiff the next day. And so pregnancy is essentially that every single day your body is doing things it's not used to doing, it wasn't doing before. And so you're essentially just like in this cycle of your body's continuously adapting. And so, yeah, I thought that was like a really cool way to see all these systems working and realizing, like, yeah, no kidding, your body's feeling a little bit sore and a little bit stiff because it's just constantly changing every single day.
Yeah, I think that's also helpful to kind of think about it in that way and say, like, okay, yeah, we are experiencing all these changes. That can be really normal. But I
Mhm.
think that also brings up a really good point. Like, in the same way that you'd be training for a marathon, like,
Yeah.
you do need to be supporting your body and fueling your body properly. And so
Mhm.
that's one thing that I talk about a lot with my patients. particularly postpartum, but also pregnancy. It's why I emphasize having really good nutrition and making sure that we're getting into good quality prenatal if you can stomach it. Like all of those things can be really important because I always say to my patients, your baby is not going to be depleted in this process. Like baby is always going to get every single nutrient that it needs. You just
Mhm.
might become a little bit more depleted in that process because your body will use up those stores and shuttling that towards baby. And so I think that brings up a good point, even what we see metabolically happening. There's a lot
Mhm.
of different hormonal shifts and things that are kind of going on to support pregnancy, but this would not be an Advanced Women's Health podcast if we didn't talk about insulin. So with insulin, what we see happening within pregnancy is that pregnancy itself is a insulin resistant state. So what that means is that your cells are responding less and less to insulin for the purpose of actually shuttling a lot of that glucose towards baby. And so sometimes I like to conceptualize this and explain that to patients because it's also part of the progression of how we see gestational diabetes progressing. If your body just is not capable of kind of handling that excess insulin resistance, then sometimes that can shift us more in towards gestational diabetes. And so being able to support glucose and insulin, making sure that we're getting enough proteins and fats and fibers so that we're stabilizing our glucose and insulin levels can be really helpful in just managing some of those weight changes and managing our metabolism through pregnancy. But that's a really big place that we kind of can do and be supportive, especially as healthcare providers, and being able to support and manage that with you. But can you talk as well, Dr. Erin, about like some of the things that you see as somebody is increasing in weight, where you're seeing some of those changes even happening to joints, or how you're kind of seeing that excess weight even playing a role in how your body's feeling?
Yeah, for sure. So, and like we kind of mentioned it a little bit in terms of those posture changes as the body's just adapting to the growing sort of things it needs to develop for your baby. You get these changes in posture. Sometimes that can play a role in the joints as well. But I think this actually lends to sort of talking about pelvic floor a little bit, which I think we'll talk about quite a bit, I think. But as you have your growing uterus, everything sort of upregulating for baby, it can kind of put some pressure on the pelvic floor. And so, before we kind of dive too much into that, I think it's important to talk about what the pelvic floor actually is, because I think it gets thrown around a lot and people are like, what actually is that? So, essentially, your pelvic floor is a bunch of muscles and its surrounding sort of ligaments and tendons that keep things supported in your pelvis. So it runs from your pubic bone, that's the bone if you're kind of on the front of your pelvis in your groin area. It wraps all the way out to the side of like your sitting bones and then also up to your tailbone as well. And these muscles essentially provide almost like a hammock or a sling, which supports all of the organs in your pelvis. So, uterus, bladder, bowels. It also provides a lot of stability for the back and the spine, supports bowel bladder function. It does a lot of really important things. And so, with that increased kind of weight, sometimes that can put pressure on the pelvic floor. That's where things like leaking or incontinence sort of feelings can happen as well. The pelvic floor is lengthening and expanding and it's preparing for delivery of baby. So it's kind of getting its work put in. And there's also ways that we can continue to support that as well, pregnancy and postpartum.
Yeah, I think that also lends well into a lot of the work that we do as naturopathic doctors too. We obviously work a lot on digestion. And so
Mhm.
one of the biggest things that can be really supportive of pelvic floor is not putting additional strain on the pelvic floor
Yeah.
by having and trying to have bowel movements. And so we do see in pregnancy, obviously, as baby gets bigger, we're crowding a lot of those organs in that area.
Mhm.
So constipation can happen just from like increased pressure in that area. But we do see that we have a lot higher levels of estrogen and progesterone, especially within pregnancy. And that progesterone itself can really slow things down in terms of slowing down our gastric motility, so our stomach motility, slowing down gastric emptying time, slowing down like our bowel movements themselves. So a lot of those things can be leading more towards constipation. So I'm working with my patients a lot, especially in pregnancy, so that we make sure that we're maintaining bowel movements. Sometimes that's with supplemental support, like laxative support that can be really supportive in pregnancy. Obviously, don't just go out and take any laxative. Not all of them are pregnancy safe, but then making sure that we're getting enough fiber, that we're getting enough of those nutrients that are going to help and maintain and support bowel movements. Because we do see, even with that increased blood pressure or increased blood volume, that can lead to a lot of venous pooling, including hemorrhoids, which a lot of pregnant patients experience or will experience that postpartum. So, a lot of the care that I'm even doing with my patients is preparing them within pregnancy, preparing and supporting their
Yeah.
body so that transition into postpartum becomes a little bit easier too.
Mhm. Yeah, and I think that I'm doing a similar thing, obviously working in different areas, but all of the work that I do with patients in pregnancy is always supporting and helping the body be strong and ready for labor and delivery, but then also recovery postpartum as well. So we're always have that kind of end goal in mind that we're keeping the body strong and capable and resilient in pregnancy and then in postpartum as well. And I think too, like with the idea of pelvic floor, a big part actually of what I do in pregnancy is working on that connection with breathing in the pelvic floor because it's not only super, super helpful for discomforts that happen in pregnancy, but also preparing again for labor and delivery. But it's really important postpartum as well. So if we can kind of work on that in pregnancy, it just makes things easier postpartum as well. And so I wanted to talk a little bit about that important connection with breathing in the pelvic floor. So essentially, we have the pelvic floor. Sometimes it's also known as the pelvic diaphragm. So if you see that around, that's kind of what it's referring to. But we also have another diaphragm in the body, which is our breathing diaphragm. So similar to how the pelvic floor is sort of like a sheet kind of muscles, you have your breathing diaphragm, which is all along the bottom of your rib cage. And it's really the main muscle that drives our breathing. And so the diaphragm and the pelvic floor work hand in hand together. When one is functioning better, the other one functions better, and they are so important in stability of the body, in strength of the body. And so sometimes what happens in pregnancy, as we kind of talked about those posture changes, pelvis tilts forward, when you move up the spine, sometimes the ribs can flare out. So that might be something that you have experienced during pregnancy or you've heard about a rib flare. And now that's also going to happen naturally because baby's kind of pushing things up as well. So everything's just getting kind of displaced. And so ribs can kind of move in response to that. But essentially, what you get there is a mismatch between how the diaphragm is sitting and how the pelvic floor is sitting. They are strongest and most effective when they're sort of parallel with each other. But if you can kind of envision it, pelvis tilts forward, ribs are kind of flaring up. Now those two aren't sitting as kind of parallel to each other. So a lot of what I work with is kind of restoring that as much as we can in pregnancy, working on the pelvic floor being strong, working on the breath and coordinating all of that together, which we'll probably talk about again postpartum, is so key in that recovery as well.
Yeah, I remember when we were kind of just talking about these things, and I was like, "Oh, I don't think I've even actually heard of that diaphragm and that pelvic floor connection."
Mhm.
And I think of pregnant patients later on and how much less lung capacity we feel like we have, and how that can be really helpful
Mhm.
of actually working on some of those breathing techniques. I know as a doula as well, like I am walking my patients through how to do some of those breathing techniques to support during labor, but being able to do that prep ahead of time and helping with that lung capacity, I think that's really amazing. So I think it was really important you kind of mentioned something about like being strong in pregnancy. And so
Mhm.
I would love for you to speak to this concept. I feel like most of the time when pregnant patients are gonna try and pick something up or do something and people are like, "Oh no, like let me handle it. Like don't like you're a delicate little flower growing this baby."
Yeah.
I want you to speak to that because
Yes.
I think we need to challenge that opinion a lot.
Yes. Absolutely, we need to challenge that. Yeah, I have lots of thoughts on that. And the biggest thing for me is that your body is not fragile. It is not weak. It is so strong. It's so resilient. it's so capable. And so much of what we've talked about already is if you look at your body, like you don't even have to tell it what to do. Like it's going through all these changes, it's doing all of these adaptations without you even knowing it. And so that in itself is just a testament to your body is so, so capable. And so that just translates to so your body's strong like in any sense of the word because it's just so capable, so resilient, so adaptable. In terms of the actual like physical quote unquote strength that we're talking about, your body's also very strong that way too. And so movement during pregnancy, bending forward, picking things up, it might become a little bit harder as your pregnancy progresses, but you don't need to worry about being weak or hurting something or damaging something because, again, our bodies are so capable. And so, a big part of what I love to do with my patients is just empower them and encourage them like you are capable. Certainly, we can be active and we can build strength even more throughout pregnancy for sure. But I love to kind of challenge that. I'm going to call it a myth because I don't think it's true. That myth that, yeah, we're weak and we need to be scared during pregnancy and we're fragile. Like, it's not the case. And I love to kind of break that down with patients as well. I think it's really important.
Yeah, can you talk? Because I think there's a lot of confusion out there of like what exercises you can do and can't do in pregnancy, particularly core exercises, because obviously as baby is growing, that's changing a lot of the muscles within that area. And we'll talk a little bit
Yeah.
about what that kind of looks like. But are there exercises maybe that we should be avoiding in pregnancy or ones that maybe we should be doing more of? Or can you just talk in general of like what you would
Yeah.
recommend to a patient in terms of exercise while they're pregnant?
Yeah, for sure. So I always say that movement is medicine, and I say that for everyone, no matter who you are. And so that's definitely still the case during pregnancy. With this conversation, I can kind of give general ideas, but I will say that this is a super personalized area of care. So it looks different for everyone. Movement, physical activity, exercise looks different for everyone. And so what's good for one person isn't necessarily great for everyone. And there's lots of different reasons. We just all have unique, different bodies. We have different interests. We have different things that we like. And so it's a very personalized conversation. But with that being said, it is totally safe to be active during pregnancy. And all of the research is pointing to we should be doing that. It's super beneficial for mom's health, directly impacts baby's health as well. Obviously, the better mom is functioning and the healthier she is, the better that baby's going to be as well. And that's even true for women who maybe weren't super active pre-pregnancy. It is safe to even start exercising or start moving in pregnancy as well, even if you weren't before. With that, obviously, there are some real scenarios where exercising isn't safe during pregnancy. So if there's any kind of complications, then there are very real reasons why that may not be the case. And so that's always should be a conversation with your birth provider and your care team. But I would say for most uncomplicated pregnancies, it's totally safe to move. And with that being said, I feel like it looks a little bit different trimester by trimester. First trimester, typically women aren't wanting to do a ton, and depending on how the pregnancy is going, some feel great, some don't. So I would say first trimester, listen to your body, listen to your energy, even things like gentle mobility work and stretching and walking like are all really great ways to stay moving during pregnancy. And again, that's like strategizing with your care team on your specific situation on what looks best. Second trimester, typically kind of energies come back a little bit, so this might be a good time to incorporate more strength sort of exercises. So maybe increasing the weight of things that you're doing, more reps, more frequency, that kind of thing. This is a good time to kind of build that side of things. And then third trimester is really like a preparation phase. So a lot of what I'll work on is, again, that breathing, dynamic, deep core, those muscles that are going to help push baby out. We want to work on those, and connecting that with the breath can be really powerful and important. Working on, mobility of the pelvis and opening the pelvis up, that's when we'll start to incorporate all of those kinds of exercises. And so it looks different throughout pregnancy in general. There's no exercises where I would say don't do that. Again, if you've never run before, maybe you don't want to do that in your third trimester, but if you were running pre-pregnancy, you can absolutely keep running. If you were lifting weights pre-pregnancy, you can absolutely keep lifting weights. You can absolutely start lifting weights if you weren't before. So again, I feel like it's a bit general what I'm saying, but it really is like a specific for each person and kind of strategizing what looks best for their unique situation.
I think that's helpful in the sense that I think people listening, especially if you are expecting or you are in postpartum, you may be hearing this and being like, oh my goodness, I could not do anything in my pregnancy.
Yeah.
I remember like I had all of these thoughts and intentions of, oh, I'm going to exercise every single day. And in my first trimester, I was like, if I do a downward dog, this is going to be a bad situation. Like, I was like, we're not doing yoga. I'm way too nauseous for that.
Yeah.
And so I think that if you're listening to this and you are feeling any sort of guilt, I just want to like silence that, because if you are experiencing a lot of nausea or you are really tired, like there needs to be a lot of grace for you in that as
Yeah.
well. Obviously, if you can move, let's get you moving. And
Yeah.
what I often talk about with my patients, particularly if we are dealing with a lot of nausea, we do see that nausea can be very related to blood sugar levels as well. And so I'm working a lot with my patients on supporting a lot of those underlying factors that are contributing to those symptoms so that you can better move, so that you can better function while you are pregnant and don't feel like you need to be horizontal on the couch all day long, even though it is nice when you get a little bit extra naps in pregnancy. And so, with that being said, certain things that I'm definitely looking at and supporting if you are feeling like absolutely exhausted and not able to function even how you were pre-pregnancy. I'm looking at things like in the first trimester, especially, our thyroid needs double. We have so much increased stress and challenge to the thyroid in pregnancy. And so that's one thing that I want to make sure that we're supporting and monitoring. And often that looks like increasing medications if you are on a thyroid medication, or supporting that through supplements as well. Thyroid's a big one. Obviously, as I mentioned before, baby's going to get what baby needs. And so we want to make sure that you are not also nutrient depleted too. So it has been said in some studies that around 27% of people by their third trimester are iron deficient. And so we really want to be monitoring those iron levels even through pregnancy and making sure that they're at adequate levels leading up to delivery, because obviously that's a big place where we can have blood loss and iron loss, and even breastfeeding will kind of deplete iron stores as well. And then we also want to make sure, again, that we're supporting our immune system. We have a big shift that happens in our immune system from being more to a Th2 immune response. And that can cause a lot more increased susceptibility to infections and things like that in pregnancy. And so there's a lot of things that we can do to actually support how you were feeling in pregnancy. And so if you are experiencing a lot of those things, know that you don't need to just struggle through it for 9 months. There are some things that we can do to actually support a lot of those body changes for you.
Mm-hmm. Yeah, that's really
So,
good.
is there anything else, Dr. Erin, that you would want to kind of mention about pregnancy specifically before we shift gears a bit into postpartum?
Yeah, I think just the last thing that I wanted to mention that we haven't come up yet is that I do have an extra certification in the Webster technique, which, if you're listening and you've never heard of that before, it's a specific technique for pregnancy. So it's an assessment tool that I use and a treatment tool that I use, really with the goal of optimizing balance throughout the pelvis, and then addressing some of those muscles, ligaments in the area that can be irritated with pregnancy as well. So, round ligament pain, if you have any pubic symphysis pain, these are all things that really benefit well from using the Webster technique. So if you're looking for hands-on chiropractic care and you're pregnant, it's a great idea to look for a provider that does offer the Webster technique, just gives that extra sort of training and knowledge in working with pregnant patients. So that's just a great thing to keep in mind if you're seeking that kind of care.
Yeah, I think that's good. I personally had a lot of round ligament and pubic symphysis pain in pregnancy, and chiropractic was really helpful for that. So,
Mhm.
yes, go seek a chiropractor if you're feeling a lot of those things in your pregnancy.
Today's episode is brought to you by none other than Advanced Women's Health. If you are interested in diving in deeper to your health, if you are finally ready to feel like yourself, and you are finally over hearing everything's normal, everything's fine, and you want a deeper dive into your healthcare, then we are here to help you. We are currently helping patients in British Columbia and Ontario, Canada. But don't worry, if you're in another province, still reach out, get added to the wait list as we expand coast to coast. We cannot wait to work with you. Check out the show notes for more information on how to get started.
Okay, let's shift gears a little bit and talking about postpartum, because I think postpartum is something I'm so passionate about talking about, because what often happens is that you have so much attention on you as mom when you are pregnant, and then baby gets delivered, and then it's just like, oh, we're expecting you to just bounce back and be yourself again, and you are still going through a lot of body changes in that postpartum
Mhm.
period. So, can you speak a little to some of those big changes that you see, Dr. Erin?
Yeah, for sure. And I kind of want to echo that too, that we want to challenge that idea of bouncing back or getting back to who
Yes.
you were before, because you aren't the same person that you were before. And your body has just gone through some incredible things a lot. And, postpartum comes and you continue to get changes every single day. So you aren't the same person. That's not the goal. We're obviously looking forward, recovery, building forward instead of trying to kind of be who you were before. So, with that being said, a lot of kind of the similar things we talked about in pregnancy can kind of flow through postpartum. So, again, as a chiropractor, those kind of aches and pains that I see just are as similar to what we see in pregnancy, but also you're doing different positions. Maybe you're breastfeeding, maybe you're bottle feeding, you're carrying baby, you're bending over the crib or the bassinet, you're carrying car seats, you're doing all these new things that, again, as we talked about, whenever you're doing new things, the body can kind of respond. And again, it's going to adapt and it's going to build the ability to do those new things. But sometimes it gets a little bit sore and achy and stiff. So, those are all things, again, that I address postpartum as well. So often, a lot of mid back tension, neck tension, wrist, thumb pain. There's even a condition called mom's thumb, which essentially, it has some tendons and muscles that move your thumb that get irritated with all this new movements that you're doing. So, again, these are all things that are very treatable. They respond really well to hands on care, to movement care as well. So, those are some big areas that I see as a chiropractor postpartum.
Yeah, I think that's good to talk about those aches and pains in postpartum, because I think you think about it in pregnancy, you're like, oh yeah, this baby is growing. Of course, I'm gonna like maybe feel uncomfortable at times. That's not everyone's experience. But I think a lot of people don't expect to feel a lot of those kind of aches and pains in
Mhm.
postpartum period too. And so that's one thing that I'm talking a lot about my patients, because what we can even see is obviously some of those changes will happen because of different movements that you're doing. But if you're not repleting yourself with proper nutrients,
Yeah.
you're also not supporting your body properly in that recovery. And
Mhm.
postpartum is recovery. You
Yeah.
have just birthed an entire human being, however that happened, whether that was vaginally or C-section, and there is healing that needs to happen. You have a
Mhm.
large wound that shows up within your uterus, and usually we're seeing in uterine involution of the like uterus going down. That's taking around 10 days to actually get back down to that normal level. Sometimes that also results in some aches and pains and feeling of that, especially with subsequent pregnancies. But we need nutrients. I think there's a lot of conversation about, oh, if you're breastfeeding, especially, that the weight's just going to fall off. And I think there's this temptation in this toxic culture that we have of bouncing back to be like, oh my goodness, I need to get back to what my body looked like before. And there is
Mhm.
that temptation to maybe restrict calories or changing things that way. Or even just very unintentionally, you become a very busy mom and you're like, I have not eaten anything since yesterday. And so that's something that I am very adamant about supporting my patients with as well. You need protein, you need fiber, you need those building blocks that are going to be able to actually support that recovery. And especially if you are breastfeeding or pumping, like you need those additional caloric needs too to be able to support your baby better.
Yeah, I think it's just a similar idea that we talked about. Pregnancy is a marathon, postpartum is too, and you
Mhm.
need to fuel your body, train, allow your body to have that time to heal and the resources it needs to heal. Because again, it's a process, you're recovering, and then any kind of building on after that just continues to need that fuel and those resources.
Mhm. So can you talk a little bit about like some of the pelvic floor changes that you also see in postpartum? Like that was something we talked about pregnancy wise, but even I know there's a lot of conversation about like diastasis recti and what that's all about. Can you tell us what's going on there?
Yeah, for sure. So, diastasis recti, if you aren't familiar with that term, it essentially is a separation that happens between your abdominal muscles. So, if you think of your quote unquote the six pack muscle, I don't like to call it that because, but it helps people to understand which one we're talking about.
Yeah.
This starts in pregnancy. So again, as your baby's growing, it's going to sort of push everything out and lengthen. And so there can be a separation that happens between those muscles in the middle of your abdomen. It's not torn apart, it's not broken, it's just kind of stretched. And so there's a separation. Often you can see it if you ever kind of do like a crunch position or something like that, you might see this sort of coning or doming that can happen. Again, this is so normal, and I think every pregnancy is inevitably you will have some kind of separation that happens, and that doesn't just magically go away postpartum. The separation is still there, and so it's a big part of what I will work on. Pelvic floor physios will work on this as well. Is just encouraging that tension to come back through the abdominals, retraining again that breath and core and pelvic floor connection. And eventually it will kind of come back together. It will tighten back up. The abdominal muscles will start to reactivate better. They'll get stronger. All of this naturally will happen. But there's ways, also exercises that we can do to help build that coordination back and help build that strength back. And so, with that being said, there's also a myth that surrounds diastasis as, oh, I can't work my core. I can't do any core exercises, or it's going to make it worse, or it's going to be bad for me. And again, I'm going to challenge that myth that we should be working our core. And that's how we're going to get that reintegration of the core activation coming back. We're going to build strength back into the abs and into the spine as well. There are some exercises that are better for that. So anything where the spine is in a neutral position are ones that we're going to work on. So things like when you're on your hands and knees, that's a great sort of position to not put extra tension on that diastasis. We tend to do less of sort of forward motion, so less crunches, less things like that. But the core is absolutely safe to be trained while you have diastasis. And in fact, that's a really good thing to help bring that coordination back.
Yeah, I think and that's really helpful to know that because there are a lot of myths. There's a lot of myths in general about pregnancy in general, but particularly with exercising in pregnancy and postpartum. And so kind of talking about the pelvic floor, I think one area that just is not discussed very much is those changes that happen even perineally or
Mhm.
vaginally after you've had a baby. And so we do see this a lot, obviously, if you've had a vaginal delivery, if there was any tearing, if is scar tissue, some of those things obviously can impact kind of how you feel and even change the experience of intercourse postpartum. But I think one thing that I would like to shed some light on, even from a hormonal perspective, is that if you are breastfeeding and you have not gotten your period back, we're in a really low estrogen state within within postpartum. And so similarly to what we actually see within menopause, where we don't have as much of that estrogen impact onto the vaginal tissue, we can see a lot of vaginal dryness. We can see even some vaginal atrophy kind of happening there, more so because estrogen is really helpful for allowing for vaginal tissue stretch. And so one of the things that a lot of pelvic floor physios will also do and help support would be to look at that vaginal tissue. But even from a naturopathic perspective, sometimes we're going to be doing some support for some of those hormone levels, even as you are breastfeeding. And sometimes that even looks like doing a topical vaginal estrogen. And so I want to kind of bring that and shed a little bit of light on that as well. If you're really struggling with intercourse postpartum, being able to engage some of different practitioners like chiros, like naturopathic doctors, like pelvic floor physios, those can all be really helpful, and having different lenses and being able to support different aspects of why you may be having that discomfort postpartum.
Yeah, I think that's a big thing that we wanted to get across too, is that it's so important to have your care team, because just like it's so cool in this podcast that we can share our different sort of strategies and our skills and knowledge from different professions, it's so important and beneficial if you can kind of have your care team around you to help target these different things, because we all have the same goal of wanting to support you, and we're just all able to do it in different ways. So that's really
Mm.
important.
Yeah. Yeah, and I want to even kind of reiterate, I think there, as we mentioned earlier, there is this culture of talking about bouncing back postpartum. And so obviously we very much want to challenge that in that kind of perspective. But I think it's really helpful to talk about the fact that if you are not feeling like yourself postpartum, there's a sense of normalcy that kind of happens. You are this new person. You have this new identity as a mother, as someone that's caring for a baby. But there are other things that we can look at that can be really impactful for your postpartum experience. And so I am a very big proponent of doing blood work and making sure that we're monitoring labs. And so a lot of times I have patients that come to me and they have not had any blood work done since they were pregnant, and they have maybe been a year postpartum. And when we actually run some labs, we can take a look and see some of those very testable and very treatable things that can show up and really impact how you are feeling weight wise, how you are feeling metabolically, how you are even feeling mood wise. And so some of those big things that I just want to at least shed some light on so you can keep it in your mind to talk to your provider about are thyroid again. So we see really big shifts that happen with the thyroid from pregnancy to postpartum. And sometimes that can also show up both with autoimmune thyroid presentation, so antibodies that can cause a lot of inflammation of the thyroid. Sometimes that shows up as more hyperthyroid symptoms, so a lot of anxiety, racing heart, palpitations. Then we can also have that shift into rapid hypothyroid symptoms too. And so sometimes that results more in more weight gain and changes with mood, lower energy levels. So testing and making sure that things with the thyroid are okay postpartum is something I do routinely with all of my patients. Also taking a look at autoimmune conditions that can show up postpartum. So again, as we have a really rapid shift from a Th2 immune response to a Th1 immune response, and we have really big shifts that happen hormonally from lots of estrogen, progesterone in pregnancy to a big drop in that postpartum, we do see higher rates of autoimmune conditions that can show up. And again, that can also be part of where some aches and pains can come from too, if we're seeing that showing up and affecting joints as well. And so those are a lot of big things that I definitely take a look at. I want to make sure that we are repleted from an iron perspective, a B12 perspective. There's a lot of key nutrients that we'll look at. But I do want to just shed that light that if you are not feeling like yourself postpartum, there are things that we can take a look at and can be really testable and treatable, and it can really change your postpartum experience.
Yeah, and I think another part too that I want to mention about this idea of bouncing back is also talking about if you've had a C-section, you
Yeah.
have had a major abdominal surgery, and so you should not be expected to bounce back. And again, you aren't the same person that you were before. We need to heal and recover. And so I wanted to kind of just bring that up, that there's also this additional set of supportive things that we can do for somebody who is going through a C-section recovery. You are a different situation, and so there's different ways that we can support that recovery from once the scar tissue has kind of healed. There's ways that the scar can be mobilized. There's ways that, microcurrent therapy can be beneficial, and acupuncture as well. And I wanted to ask you, Dr. Heather, I know obviously you do a lot of acupuncture as a naturopath, so I'm curious kind of what you would like to say about that.
Yeah, I love acupuncture. I think it's really supportive. I use it a lot within pregnancy. We've seen some studies that actually doing pre-labor acupuncture can really improve birth outcomes. So it can help support and tonify the uterus to actually labor and push out baby easier. We do see like lower rates of C-sections from some of the research with acupuncture pre-labor, but even
Mhm.
from that postpartum perspective, we can use acupuncture even around scars, like C-section
Mhm.
scars, to help reduce that scar tissue, improve blood flow to the area, improve collagen production that can help to kind of release some of that tension. And then I also love using it even for my patients that are breastfeeding. It can be
Mhm.
helpful for releasing some tension in the neck and the shoulders and traps.
Mhm.
But we do see that some points can actually be really helpful even for stimulating and encouraging milk production if low milk supply is something that you're experiencing as well. I love using herbs for that too. There's so many things that we can obviously do. Erin and I were saying that we could probably have an entire podcast on just pregnancy, an entire
Yeah.
podcast on just postpartum, and there's lots that we can do to support that. But yeah, I hope that as you're kind of listening to this, if you're experiencing any of these things, you know that, okay, there are ways that I can support and that I
Mhm.
can get support, and I don't necessarily need to just struggle and push through if things aren't feeling great in pregnancy or postpartum.
Yeah, I think that we want to just kind of share there are all these different practitioners that do lots of different things, and within practitioners, there's so many different things that we can offer. So we're really able to help support your body through all of these changes that it's experiencing.
Mhm. And obviously, we haven't touched on this a ton, but there is that mental change and just all of the mental thoughts that you have as you are kind of experiencing some of these body changes through pregnancy and postpartum. And so, some of the practical things, like if you want to take a little takeaway from today, if you really are struggling with how your body feels and looks and moves differently within postpartum, especially within pregnancy, some of the things that I talk about with my patients is even just getting different clothes. Like that sounds really funny, but if you're breastfeeding or pumping and like the whole transition in needing new bras, that can feel like really daunting sometimes and feel like really uncomfortable. Or even just as you're kind of in experiencing your postpartum and you're feeling like, oh my goodness, I can't fit into any of my old clothes again, but I also don't know that I'm gonna like be in this body like this forever. Like, and you're just feeling this in between. I'm often talking with patients about being like, you know what, just buy at least one new pair of pants, buy like a handful of tops, something that makes you feel a little bit better in that experience because your body has gone through something so different and so amazing, and it's worth celebrating and it's worth clothing your body properly so that you feel comfortable and that you feel good in your body, even as you're starting to support and manage your body as it is going through a lot of these changes. And so, those are things that I often will talk about with patients and talking about that mindset as well. And I know you, Dr. Erin, I love a lot of the things that you've said about like celebrating how strong our bodies are. I really do hope that if you have just experienced having a baby or you are pregnant, that you really do take a moment and stop and celebrate and be like, you know what? My body is incredible for everything that it's done. As we said, we could literally talk forever about all of the weird symptoms and things that your body can go through and will go through in pregnancy and postpartum. But for that, I really do hope that you're sitting here and you are in awe of what your body is capable of doing. And sometimes that mindset shift can make a really big difference to even how you see and view your body in postpartum and pregnancy.
Yeah, I think that's so key, and I hope we've kind of hope we haven't belabored that too much, but also we want to just really encourage that pregnancy and postpartum, they come with constant change. Your body's designed for it. It knows what to do. It's so capable. And there are just these extra ways that we can help support you through those changes. So we hope that you are feeling encouraged by everything that we've talked about.
Yeah. Is there anything else, Dr. Erin? Any last takeaways, big takeaways that you want anybody who's listening to kind of know from what we've chatted about today?
Yeah, I think that the biggest takeaway is that your body's so strong and capable. There's so many people out there who want to support you. There's so many practitioners that have this passion and this desire to work with women through these different stages of life. And so just the importance of building that care team and knowing that, yeah, there's people here to support you. You are so capable, and yeah, we just want you to feel encouraged leaving this.
Amazing. Well, thank you so much for listening. Obviously, if you have any moms in your life that are kind of going through and navigating some of these things, we'd love for you to share this podcast with them. Obviously, if you're looking for practitioners to support you through pregnancy and postpartum, we would love to work with you. We are currently in Ontario, Canada. Dr. Erin, again, works in Port Credit. I work in Brooklyn, and I see patients virtually as well. And so thank you again for listening to the Advanced Women's Health Podcast, and we hope you have a beautiful day.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.